Finding a sunscreen you actually want to wear can be harder than it should be. Ideally, it should protect against UVB, the rays most associated with sunburn, and UVA, which penetrates more deeply and contributes to skin aging. UVB is more closely linked to skin cancer, but both types increase your risk. There are generally two types of sunscreens. Mineral sunscreens, which contain actives like zinc oxide, are very effective at blocking both UVA and UVB, but they can feel heavy and tend to leave a white cast, which isn't really ideal for daily use. On the other hand, you have chemical sunscreens, which usually feel more lightweight and invisible, but each active ingredient is often only effective against one type of UV, so formulations have to combine different ingredients to provide broad-spectrum protection. Another issue is that the most common UVA chemical filter in the US, avobenzone, degrades easily in sunlight. It can be stabilized by other ingredients, but there are also concerns that avobenzone might be absorbed into the bloodstream at higher concentrations than we previously thought. The sunscreen options available in the US often feel like a trade-off, but the solution could be a new ingredient, bemotrizinol, which was approved by the FDA in June 2026. Bemotrizinol is different from many US chemical sunscreens in a few ways. It's a single chemical filter that provides broad-spectrum UVA and UVB protection, so there's no need to combine other actives. It's highly photostable, so it holds up better under sunlight exposure, and it's only absorbed into the body at low levels. If you're thinking, haven't I heard about this? It's because you probably have. Bemotrizinol isn't actually new. It's been used in sunscreens outside the US for decades, and it entered the FDA's approval process back in 2005. So why the delay? Well, a lot of other countries regulate sunscreens more like cosmetics, but in the US, they're regulated as over-the-counter drugs, which comes with a higher bar for evidence. From 2020 to 2025, new legislation was introduced that changed how the FDA approves over-the-counter drugs, especially sunscreens, which made the process more efficient and reduced backlogs. Bemotrizinol is the first ingredient to be approved through this new process, and the first new sunscreen ingredient to be approved by the FDA in 20 years. Manufacturers can start including it in their sunscreen formulations beginning August 9th, 2026, so you might start seeing it on shelves soon. If you want to understand the process of drug review and the regulatory steps that are needed to take a drug from clinical development to public use, take a look at our HMX course on clinical drug development.